It goes back well over a decade that I've been familiar with Dr. Marshall and his work at Omega Boys Club, and so proud of his efforts and advocacy, and most importantly, proud of not the rhetoric, but the success, the outcomes. And it's all about evidence-based solutions. It's all about moving from words to deeds, and I think that's what Omega's demonstrated.
The city's adoption, the city of San Francisco's adoption of the Alive and Free prescription as the basis for its violence prevention plan is something we've been wanting here for years. You know, we know that this thing works. It's worked here at the Omega Boys Club. It's worked with folks around the country, literally around the world. This is a huge step further. This is a city saying that we want to make this the basis of how we do violence prevention.
There are partners throughout the city of San Francisco who buy into the Alive and Free methodology, and we know that it's used in various agencies around the nation and around the world. And it was homegrown right here in San Francisco. And so it only made sense that we would too be using the Alive and Free methodology and prescription. I think that this is the first time, however, that a municipality, an entire municipality, has adopted it and is requiring that all city-funded agencies participate in the training.
A big reason we're here today is to reframe this issue of violence prevention as a health issue in a way that the city hasn't in the past. And we have an initiative that you'll be seeing in billboards all around town, the Stay Alive and Free campaign, and it's connected with a website and other collateral material.
This is a health approach, so we'll be doing prevention, we'll be doing intervention, we'll be doing rehabilitation. Part of this really deals with trying to get people not to commit crime.
San Francisco, through adopting this plan and moving it forward, and more importantly, implementing this plan, is taking a leadership role in what I believe is going to be an emerging new urban agenda across this country.
Today we have a renewed sense of hope because finally we have come together as a family. And I think we have the potential resources, intellectual powers to bring an end to this senseless violence.
We know that law enforcement is not the end-all and be-all. There's a time and a place for that. But we were very grateful to be included in the process that was initiated about 2 years ago. We are proud to be part of this plan.
Today was the launch. It was great. You know, I've been working on the mayor for a couple of years now, talking about this whole approach that we use. It's a health approach. And he bought it, and he got other people to buy it. So we're really excited. We think this can be a model for cities around the world.
I just think he's right on message. You want to prevent something, then we've got to look at it as we prevent disease, as we prevent people from getting sick. And what are the conditions that exist? And so taking the disciplines of health, which is comprehensive, soup to nuts, beginning, middle, and end, and incorporating a strategy to allow people to live free and healthy and safe, I think is an appropriate discipline as it relates to looking at crime and violence.
What we discovered in the planning process is that while San Francisco funds extraordinary efforts, there's no uniform philosophical underpinning, and Alive and Free provides us just that.
What's also wonderful about it, we've got the mayors of Oakland and Richmond to buy into the way we're doing things here. So this will be a regional approach to the problem of crime and violence.
The people that are victims and perpetrators are transient, and so they're crossing the Bay Bridge, they're using BART, and there are incidences being committed in all three cities by perpetrators that are residents of all three cities. And the sooner that we see that this is not a jurisdictional issue, but really a regional and statewide national issue, I think the better off we'll be in terms of the strategies we employ to really combat this problem.
We hope to learn from other cities. We've looked at other cities, 45 other cities through their Unity program and project, but we want to take it to the next level. We want to become the model city in the United States. How appropriate with Omega here, Dr. Marshall here, and member of the Police Commission. We should expect nothing less, and I'm committed. I just got into my second term. I'm going to be around to making sure that this becomes the preeminent model in the United States.
The Alive and Free movement is critical, it's urgent, it is today's civil rights movement, and there is a generation thirsting for a movement to become a part of, and I think this is it.